Still technique. Typical cervical vertebrae. Flexion, rotated right, side bend right. Ask the patient to sit comfortably on the edge of the table. Stand in front of the patient. Adjust the table so the patient's head is at or just below your eye or shoulder level. Contact of tissues. Monitoring hand. Contact the posterior articular pillar of the dysfunctional segment on the side of rotation. Lay or palpate to the bone to monitor for tissue texture changes and motion. Operating hand. Contact the vertex top of the patient's head, which will be used as a long lever. Application of principles. Monitoring hand. Maintain contact throughout entire procedure and palpate surrounding tissues and position of dysfunctional segment. This hand is used to ensure that the operating hand is localized to the level of the dysfunctional segment and will move with the dysfunctional segment. Operating hand. Place the dysfunctional segment in the position of the somatic dysfunction in all three planes using the head as a lever. In this example, flexion, rotated right, side bent right. The monitoring hand should detect some decreased tissue tension. Add a downward compressive force just until the force is felt with your monitoring hand. Tension in the surrounding paraspinal musculature should again decrease slightly. Visualization. View the activating force as a vector from your operating hand directly to your monitoring hand. View the long lever as one functional unit. Fluidly move the patient's head to move the occiput in all three planes of motion, simultaneously toward, then through the restrictive barrier. In this example, extension, rotated left, side bent left. Release the compressive force. Return the patient's head and neck to neutral position. Retest.